Great. Good morning, everyone. I'm going to go ahead and call this meeting to order. Today is the Assembly Housing and Homelessness Committee meeting, Wednesday, April 17th from 11 a.m. to 12:30 p.m. here at City Hall, room 155. Let's go ahead and start with introductions of Assembly members. I will go ahead and just, for purposes of ease, introduce Assembly Member-elect Mr. Littlefield. Thank you for joining us. And then we'll start with everyone else.
Zach Johnson.
Karen Bronga. Anna Brawley.
Felix Rivera. And then Assembly Member Constant has joined us. And then we don't have anyone else on the phone. All right. So before we do initial audience participation, which I believe we have one individual signed up for, I will just say that this, a quick preface on the meeting today. So we are going to be spending most, if not all, of our time really centered on Anchored Home and what I have been calling Anchored Home 2.0. And this has been something months of anticipation of getting the latest update of Anchored Home. I'm not going to steal the coalition's thunder any more than that and say I'm just very excited for this presentation. So with that, we'll go to initial audience participation. We have one individual signed up. So Mr. Say, if you can come on up. We have your timer. So welcome and turn on the mic. There we go.
All right. Thank you, guys. I appreciate the opportunity to share. My name is Rob C. I am Deputy Director for Henning Inc. I'm also a person in long-term recovery. What that means to me, I've successfully recovered from a seemingly hopeless condition, thanks to a God of my understanding and a community of like-minded individuals. I have been able to progress in my recovery, and I'm really grateful and thankful for the opportunity to share today. As you guys know, we operate over 2,000 people in the city's homeless response system out of 3,200 in Anchorage. Because of that, we support the erection of the Navigation Center. We have hired a real estate development team to provide due diligence and professional third-party advisory outside of politics. The bottom line is homelessness is not seasonal, and we're putting lives at risk the longer we delay. We will have a public orientation April 23rd, 9 to 10 a.m. for more information. More information will be made available on our website and social media platforms. Just again, my personal experience, I've been on this response since the beginning of COVID. As a person in long-term recovery, I made the transition to a professional in long-term recovery when I worked for Cookland Tribal Council. I made that adjustment there. And then I worked for the health department as a contractor for mass care. And I've got to see it from the ground level. And I can solidly say that from the bottom to the top, my heart is in it for the people we serve, for the service providers that provide service. I'm just here to try to take politics out of this and to really just serve the people. I think we have an awesome opportunity. I've seen some amazing things happen when there's been collaboration between the administration and the assembly. And I've been on the other end of that too. I think we have an awesome opportunity here, and I'm looking forward to be able to share a more robust presentation on the dates that I just said before. So thank you. Appreciate it.
Great. Thank you. Member Brawley?
Yeah, I just had a brief question. So you mentioned the Navigation Center, and it sounds like you're going to have more information. Where would you propose to put it?
I would propose that we I think there's been concrete poured in that same location that was been talked about off the Tudor. But again, this is a conversation we would like to present more details about it, and welcome any questions through email. I did send an email out to every assembly member, and I appreciate you, Karen, for responding to that. Chris, I appreciate you responding, and Felix, I appreciate responding as well.
And sorry, just to be super clear, so what you're proposing is the Navigation Center, so the sprung structure at the location of Tudor and Elmore?
Yes, ma'am.
Okay, thank you.
Great. Thank you. Thank you for your testimony. All right. As usual, we will have final audience participation at the end of our meeting. So we will make sure to save time for other folks who may want to participate. So if we can go ahead and have the coalition folks come up. Great. Thanks for joining us. So I think for the purposes of this meeting, we're going to go ahead and start with the Anchored Home 2.0 presentation, and then we'll end up with any general updates that the health department may have for us at the end.
All right, good morning, everyone. My name is Meg Zolotal. I am the Executive Director of the Anchorage Coalition to End Homelessness. I'm joined today by our Chief Operating Officer, Jessica Parks. We are really excited to be here with you all to do the public debut of Anchored Home. As you remember, 9 to 11 months ago, we gave you the general structure of what Anchored Home would look like. And then we took it out for considerable community engagement. I appreciate Mr. Rivera calling it 2.0. I would actually recommend you all think about it as not a 2.0. It isn't a new Anchored Home. It is a manifestation of a lot of work that has come before it. That puts us on a trajectory to do what we need to do to be a successful homelessness prevention and response system. I like to say, everyone's been like, where's Anchored Home? Where's Anchored Home? I said, Anchored Home is in the action you see every day responding to homelessness. But now we have the paper, which I know has been desired for some time. So we'll walk through this slideshow. We are really excited for this because we believe it will guide our work not only for the next 5 years, but really memorializes a lot of the work that's underway. So we can go to the next slide. So it's an action-oriented guide. There are a lot of actions in this plan. It's data-driven. It's got goals and baselines. It's very measurable. And in the end, just to kind of cut to the chase, the entity you hold responsible for the progress under this plan is us. We take responsibility. It doesn't mean we don't need the community to find success under this plan, but if you remember the prior Anchored Home, it really relied on individual programmatic success. And here it's about convening and working together to achieve the system performance measures and the metrics. And as we move through, I think you'll see how that works. We also place equity at the forefront. So HUD in particular has really put equity front and center. We know that individuals experiencing homelessness are highly overrepresented amongst the Alaska Native American population and Black populations in Alaska. And so we want to address that head on. Next slide, please. So housing's a solution. This is really capturing the work of our community to take steps to be a housing first community. But we know that our homelessness is a housing crisis, but also that when we say housing first, or we talk about housing, we're not just talking about housing, we're talking about housing and adequate supports, supportive housing. You'll see two pictures there. Just we'd like to recognize Alice Sinkier. She is the chair of the Continuum of Care. They adopted this plan last week. They are required to have a strategic plan under federal regulation. And then our organizational board president, Nathan Johnson. We do cite to the interagency roadmap, the federal strategic plan, because you'll see a lot of overlap here. And that was a conscious decision, because the more alignment we have with the federal strategies, the more likely we are able to show success using the federal system performance measures and metrics, the more likely we are to bring more money to our community to address homelessness. All right, next slide. So we've talked a lot about this. Housing's not only provides people with a platform for a better life, it's also better for the bottom line. So shelter's approximately $100 a night. Housing with supports about $85 a night. So we've really dug into, since December, the economics of this. And we know we get a better, we can use our money more efficiently looking at housing with supports. Next slide. We also want to really highlight homelessness and healthcare are connected. And there's a cost to that. There's a significant cost when people experiencing homelessness have health issues, whether it is in the emergency room or hospital stays. And so you'll see a focus on healthcare as we move into the action items. Next slide. All right, so progress since 2018. We have been busy, and you all know this. You all have been busy as well. Here are some things that have happened that we think really lay the foundation for the Anchored Home Plan: coordinated street outreach, better emergency shelter that are housing focused, incentives for landlords, and just a general citywide housing focus as the solution to homelessness. So those are 4 big milestones, and we could talk probably all day about all of the little things that happen under each of those and how everyone has really come together to make those possible. Next slide. Great. So Anchored Home, it's a community plan. We got a lot of feedback. It builds on the prior plan to take the work to the next level. We make commitments to report back to the community on challenges and progress using our data and regular updates on our website. Of course, if you all want any reports, you know where to find us, and we will be happy to provide those to you. Next slide. All right. So we launched January. We had a feedback timeline of about 5 months. We did a number of presentations. We did social media and email outreach and surveys to talk to individuals with present lived experience. We received 212 responses from our shelter surveys, 100 responses from service providers and the U.S. Interagency Council on Homelessness, and 12 responses from the general public. All of that feedback informed our plan. So let's jump in. Strategic directives. These are, in some ways, you could call these the lanes of work. So what they are the areas or the focus areas that we are using. These strategic directives align with the federal strategic directives. But we think they are very applicable, and you'll see as we talk about the actions about how we can operationalize them here in Anchorage. So housing, supportive housing, we know that housing, supportive housing and support services, these really all come together to create a successful model. Data, our data really should drive and inform our investments and tell us how we're doing. And we'll talk a lot about metrics. Coordination, the more we can coordinate, the more we can improve information as well as funding coordination, the better we'll be at leveraging our resources to address the issue. And then, of course, equity, which I mentioned. But equity isn't just about racial equity. It is also about expanding partnerships to include people with lived experience and ensuring meaningful participation and compensation for their time and expertise. So next slide. So we take the directives, those are kind of the buckets of work, if you will, or the lanes of work. And then we have system performance measures. System performance measures are set by HUD. These are something that are used to tell us overall, how are we doing as a system to address homelessness? So you'll see we want to improve. Organizations will better identify, engage, and collaborate to rehouse individuals experiencing homelessness, including through a housing first approach. We want to reduce the average length of homelessness. So the average length of homelessness right now for us is the biggest red mark we have on our record. When we do our annual funding competition, we get scored. The place where we lose money is, or lose points that could affect our money, is length of time homeless. We have folks who've just been experiencing homelessness for too long. And there's a lot of reasons for that. One is we are a very underfunded system. So you'll see a variety of approaches here, but also as we get more and more coordinated, we should see that length of time homeless go down. We also want to work with our partners to keep people from experiencing homelessness when they exit public systems such as child welfare, prisons, and mental health institutions. We do see a lot of inflow from reentry, and then we all know those stories about discharges from API directly to the streets or shelter. We want to improve access to affordable housing, healthcare, and person-centered supportive services. we'll talk about that directly as the actions, but we know that affordable housing, healthcare, and being very person-centered will help with housing retention. So once someone is housed, keeping them in housing. And then we, as the continuum of care, will grow capacity to use data and track system performance. Our data system and how we track everything has to grow along with all of the efforts that are underway. And that's something that has to work in coordination. All right, next slide, please. So let's jump into the first bucket. Housing, supportive housing, and supportive services. You'll see the metrics there. What you will see is, although there's a lot of coordination or work here or activities that are about bringing groups and entities together, in the end, it comes down to how is it affecting the people, right? Number of people experiencing homelessness, length of time homeless, percentage of people exiting, and percentage of people exiting to HUD or other subsidized housing programs. So it's really important to keep the metrics in mind, because ultimately, at the end of the day, we're interested in solving homelessness for the people experiencing homelessness. So whatever thing we might be doing up here, in the end, we want to measure it by how it's working on the ground and affecting the people. So this bucket is to expand engagement, resources, and incentives for creation of new, safe, affordable, and accessible housing, increasing the supply and impact of permanent supportive housing for individuals and families with complex needs, and increase the use of evidence-based service delivery across all program types. So what does that mean? Next slide, please. So lots of actions here. We want to support additional housing as identified in the annual gap analysis. So we just wrapped up the point in time count. After the point in time count, all that data gets cleaned up. We will produce the gap analysis that is coming soon. But what we know is we need housing. So we are making a commitment to actively support the creation of 150 housing units a year. By that we mean housing units specifically for people experiencing homelessness, whether that's new units that have particular set-asides, whether that is agreements with landlords to start setting aside their units. They don't have to be new construction units, but units specifically for people experiencing homelessness. Right now, when we talk about housing creation in Anchorage, we often talk about affordable housing creation. That's great, but those aren't often set aside for people experiencing homelessness. They are set aside for individuals with certain income thresholds. And we know there's a large amount of housing insecurity in our city and our state. And so we said, okay, we don't want to be in competition. So we need to go out and create resources to specifically address our issue. So in 2023, we, with partners, participated in the creation of 120 housing units. Those were the remaining hotel units that came online. We want to strengthen subsidy programs and vouchers to increase affordable housing. Right now, there are no set-asides in Alaska in our voucher programs for people experiencing homelessness. So our housing choice voucher, which is our primary housing voucher, has a wait list of about 3,400 people. Those 3,400 people are all people who meet the general voucher requirements, which are primarily based on income. And the lottery to get on the wait list, lottery to get on the wait list opens up every year or two. And it's really hard for someone experiencing homelessness. So I'm going to apply for a chance to get in line and wait. So we really need to think about how we can have vouchers that support people experiencing homelessness, whether through additional projects. So Carla Manor, for example, is a voucher-based program. So if you get into Carluck Manor, your rent is paid for because of the nature of that program. And this is we often talk about the Houston model. This is where Alaska and Anchorage differ significantly from Houston. So we get $4 million a year from HUD. That's for the supportive services only. In Houston, they get $40+ million. They also have vouchers on the other side of that equation to match up with the supportive services. So we really think vouchers are a big key to this, and we want to work collaboratively with Alaska Housing Finance Corporation to do that. We want to engage all sectors for donations of land, resources, and property for affordable housing. The goal there is to establish and formalize 100 partnerships with non-homelessness service provider partners through education and shared objectives. Right now, we don't have any formalized relationships, but we think it's important to really paper this process. The relationship shouldn't be if I'm in this seat or Jessica's in that seat or Mr. Rivera is in that seat, but it should be about the organizations having partnerships and shared understanding and shared goals. We think that that will really show system maturity, and it really acknowledges that the coalition needs to go beyond service providers. Homelessness is a community-wide issue that requires a wide breadth of community-based partners. We want to improve access to healthcare and person-centered supportive services. We have a healthcare integration director. This is a really big focus for us. So our goal is to increase integration of homelessness and healthcare services through no less than 4 formalized partnerships. Here we're talking about 4 formalized partnerships where someone could have had inpatient care to so that we can hopefully stop the outflow from inpatient care to streets or shelter, and we can work on that housing journey sooner. And then, of course, coordinate robust street outreach to unsheltered people with a housing first approach. We currently coordinate street outreach. We report our metrics, but we don't use individuals housed as one of our metrics. We're going to start. So we really laid the foundation for the last 2 years about talking about data, getting people into HMIS, the data system, and creating those relationships. We're ready to take the next step, literally through the next step, and work on shortening that housing journey from street to housed as fast as possible. And we want to be held accountable for that. So that's the housing and supportive services bucket. There's a lot to be done there.
If we can go ahead and pause. Thanks. So I'll go ahead and just at the end of each of these buckets, pause to see if there are any questions that members may have. I do, so I'll go ahead and ask. A couple questions from me. First is, I think part of this just goes back to just the general collecting of metrics and baselines. How regularly will metrics be measured? I know that like in each of these actions, it says every 6 months, but is that when you're planning on measuring them? Or are you going to be measuring them more frequently than that?
We can measure most of these things in real time.
Okay.
But we wanted to be able to commit to report out. We don't want the reporting under the report to swallow the work.
Sure.
But if someone were to ask kind of, how are you doing on this particular activity, we could probably get you within a 30 to 60 day window. Some of them, depending on data reporting, might have a bit of a lag, just like when you see our numbers on our website. Like right now, it's 3,289 people experiencing homelessness through end of February. So there might be some of those, but otherwise, we're going to be keeping track in real time.
Okay. How much of this data is going to be integrated into the current dashboards that the coalition has, or are you going to be looking at creating separate dashboards? How's that going to work?
So Jessica is working with our communications team and our data team to create a dashboard specifically for Anchored Home.
Got it. Thank you. Okay, I'll put you, actually, I'll put myself back in the queue. Member Bronga?
Thanks, Chair. I had a question. So first off, you were talking about length of time is one of our red marks for people who are experiencing homelessness. I'm really concerned about are you looking at any employment type things? I have a constituent who's been homeless who emails me quite frequently, and she said the one thing that just strikes me is she tells me she's my eyes and ears, and she said what she really sees is people who need the structure of work and the pride in working. And I'm wondering, have you guys, besides, I know you want housing first and then you want to work on that. Have you ever considered or have you seen any evidence that if you find people who say, yes, I'm willing to work, then you house, or can you just not do it that way with federal funding?
I can take that one through the chair to Member Bronga. Um, what our experience has been, particularly with street outreach, having conversations, is that it's really difficult to hold steady employment while you are unsheltered. It's difficult to have access to showers. It's difficult to have access to laundry, to be able to clean your clothes, to be able to go to work. But we do have people who do engage in day labor, like People Ready, as well as employment training programs. But all of our employment metrics would be an after housed metric. And that's part of that package of supportive services that we recognize that once someone has that stability of permanent housing, then they can start to address some of those needs.
So I didn't ask that very well. Will you ever do the metric or the requirement that I will give you an apartment if you are willing to take this step, so that the people that are in your 150 units, you're just waiting, you get them in and then they make that choice because they're supported, but you never we're going to house people who are willing to go through a jobs training program or substance misuse treatment. It all is, you just figure when they get into that housing, they're stable enough, they start that.
So our housing stabilization plans, once housed, address all of those things, but commitments to work or treatment are not a prerequisite in order to access housing. In fact, HUD has said we actually need to, with our COC funding, use coordinated entry, which prioritizes people first based on disability, then length of time homeless, then age, right? So those individuals may not be in the best position to work initially, but again, employment and these other things become a focus as part of the housing stabilization plan once housed. And I want to underscore that the metric really is driven by HUD after housing, and similarly, our vouchers through the Housing Choice Voucher, we're a moving to work state. There have to be certain steps taken towards employment or through obtaining public benefits if you are eligible, if you cannot work due to disability.
Thanks. Okay, Mr. Constant, and then Member Brawley.
Thanks. So on that topic, I think that there are lots of conversations about low barrier housing first, and then other providers who do shelter services in town. Are there other shelters that provide opportunities with certain restrictions that make it better for a subset of the population? Like there are some that require sobriety in town, I believe. And so it's not outside of the realm of possibility that a private shelter provider could provide a treatment opportunity, a shelter opportunity that had some predicate for treatment or employment. Is that true?
Sure, we have those shelters that exist in town. I mean, Anchored Home and these metrics are focused on housing programs. And I would be remiss, this slideshow is like the minimal version of this to get it on a reasonable number of slides. All of the activities under these buckets are in the actual Anchored Home plan in front of you. So I'm kind of trying to keep it as succinct as possible, but you will see like 4, 5, and 6 activities under each action. Thanks.
Yeah, so just as a summary, in the whole totality of offerings in the shelter universe in Anchorage, it's quite possible that some providers might find that niche very valid for themselves. But as a broad community public provider, the mission is the housing first, which has no prerequisite for housing, but uses the housing stability as an opportunity to engage in all of those things.
Correct, because ultimately we're trying to get funding for a stable system through HUD, so we follow HUD's directives.
Great, thank you. Member Brawley?
Yeah, thank you. I have 2 questions, and I guess I'll just pose both of them. You can take them in any order. One is on the metrics. Have you contemplated, or maybe it's further in this document, a metric along the lines of the number of people experiencing homelessness who enter the prison system or enter the correction system? That's one question. The other question is, could you elaborate a little more? You had mentioned increased use of evidence-based service delivery. Could you maybe talk a little bit more about what that universe looks like, and then maybe what is not in the evidence base? Thanks.
Sure. So no, we haven't considered that as a metric because our metrics are again tied to the metrics HUD has set that annual funding competition. These are the metrics HUD can pull out of HMIS at any time. And the one around entering Department of Corrections custody is tough because it presumes there's some correlation or causation of homelessness and ending up in corrections. And we just haven't seen that is something that that really impacts whether or not someone continues to experience homelessness. Now we know reentry headed the other way that's why we have a specific goal there, is to stop that flow, right? So so no, that's not one of our metrics. Evidence-based is really around where we've seen the research and we know Housing First works. And there's a lot of research around that. That's why it is a nationally adopted standard. And so that's what we mean by evidence-based. We know permanent supportive housing is something that works, and that those words, permanent supportive housing, mean something, and it's evidence-based. So that's what we mean by saying evidence-based. Similarly, our street outreach is based on evidence-based practices, where there's research to say there are certain things you do in street outreach in order to make street outreach successful. And so we're always guided by that, and we're always happy to provide kind of our base materials and the research we do. We rely a lot on HUD and HUD best practices, and similarly the USICH.
Thanks. And I guess I'll just offer, and maybe it's outside of the anchored home plan. I think it would be helpful for the community to, one, to understand, as you said, that there shouldn't be a conflation of folks entering the correction system and people experiencing homelessness. But I would also hope that the community would work to see a reduction of that, or a prevention kind of mechanism. And so maybe that's something for us to talk about on the assembly, or another entity that's tracking that. Because I think the goal, again, would be to reduce that and not to increase it. But I appreciate your comments about how this is focused. Thank you.
Great, thank you. Okay, I have myself next in the queue. So a few things from me, and if you don't have answers now, if you can just provide answers via email later, that'd be helpful. Just because this is something that gets continually brought up, I'm sort of curious what our baseline is right now for some of the metrics. So you were talking about how, like, length of homelessness, average length, we get graded pretty poorly on that. So is there a place where we can find that?
Yeah, and we'll send you the link to the dashboard. It's in the data dashboard. Yeah. And I think it's really important to underscore that the metrics on their own are metrics to measure how we do on everything else, right? All of these activities taken together should reduce the length of time homeless, and HUD just uses it as like a temperature check on the system, right?
Great. Yeah, thanks for that. So this next one's more of a comment than a question. So I think for years now, whether it's been myself as the chair of this committee or in other roles, I have continually heard about this issue of vouchers and access to vouchers. So I'm very glad to hear that this is one of your priority areas here and one of your action areas, and that you have, at least to me, what appears like a pretty ambitious goal to go from 0 to 50%. Is the coalition actively working with AHFC? And yeah, I'll just leave it at that.
So yes, and what we know is under the current plan for vouchers through AHFC, they acknowledge they are underspent. So we are bringing them some very active ideas on how to do project-based vouchers, specifically to support programs that are already underway that aren't necessarily single site, but scattered site, because we are finding much more success in that scattered site model. But we would like to be able to append that rental assistance to that.
Great, thanks. And then the last thing for me on this section is I'm very happy to see actions 3 and 4, but particularly action 4. A lot of this language in action 4 and in the activities actually mirrors quite a bit some of the language that came out of the Complex Behavioral Health Needs Task Force. So I feel like there is momentum to move in this direction of really increasing the partnership between these two systems that maybe historically haven't necessarily worked in conjunction very much. So glad to see all of this work happening. Yeah, not really a question there, but more of a comment that this is, I think, really critical part of the work. All right, anyone else? Yeah, go ahead, Member Bronga.
I'm sorry, when you were talking about, I think you said something like, we don't have a housing partner. I don't know, I wrote down partner ? Hennings. How does this intersect? Are they finding the units for your 150 of the, they have a housing program as well. Are you the same housing program? I get so confused. So if you could just clear that
So
up.
Anchored Home is nothing to do with a particular program. It's a system approach to addressing homelessness. So as we look to set aside 150 housing units a year for people experiencing homelessness, we're working with everyone, Henning included. We have, right, this is, and we'll talk about this more on Friday with the housing success stories, but the next step, the coalition is kind of the meat in a sandwich between a variety of landlords that come to us a lot of ways. We have a really, Rob Sahi has been like, man, that guy's ears to the ground and he knows where to find units. And then the supportive services are kind of the other piece of bread up here. And it's a number of organizations that are providing case management. So the idea is it's no one housing program, no one set of landlords. It's the whole system working together to provide the right housing solution for the person with the right supports.
Yeah, thank you. So next step is the 150 apartments, right?
So the next step is not that simple. It is
Okay.
a housing approach that lets us go and find any unit we can for the person that meets their needs with the right supports. And we've committed to doing that for 150 people, but it's frankly what we're likely just to do to solve homelessness. We have 3,289 people we need to get to housing. So I guess we've got to do it more than 150 times.
Thank you. Go ahead.
All right, we got a few more buckets here. This next one, I know you're all just thrilled to talk about data and coordination, because everyone loves data. So we want to strengthen the capacity of state and local government, tribe, native serving organizations, and nonprofits to collect, report, and use data, and improve information sharing with public and private organizations at the state, federal, and local level. We all want to be speaking the same language and using the same types of data when we talk about homelessness. And all of the metrics are here. It's really important that we track and know what we say when we talk about how many people are experiencing homelessness in our community. And you'll start to hear me use a concrete number. You've heard it a few times already, and I have to learn the new number every month given the data updates. But that means people experiencing literal homelessness. They're in transitional housing, emergency shelter, or they're on our streets. That number is 3,289. All right, so let's jump in for data and coordination. Next slide, please. So best way for us to know who's experiencing homelessness is the use of coordinated entry. Coordinated entry is like the welcome mat into the homelessness prevention and response system. We have really worked hard. We just had our first coordinated entry conference where we've really worked hard to shift the focus about coordinated entry as something that's required to be done to a viewpoint that is a person-centered opportunity to plan the person, a person entering the system and learning their housing needs and figuring out what is their solution to homelessness. So we have a really robust goal of 90% of service providers. You can voluntarily agree to use coordinated entry, or your funding can make you have to use coordinated entry. And then you'll see the integration there with emergency healthcare services. Additionally, we want to identify who's prioritized by subpopulation and document resources and tracking exits to housing. So the solution to homelessness is housing, but those housing with supports doesn't look the same for every subpopulation. Transition aged youth, 18 to 21, it might look quite different than a family, than a veteran. So what we want to do is we want to map those systems so we're clear on where we're looking and ensuring that we're looking for resources and system gaps across all subpopulations. We want to identify effective ways of collecting data on subpopulations that are historically undercounted. And we want to do so in a trauma-informed and culturally informed manner. We think some of the undercounting is when you simply ask a very blunt question to check a box in a survey, it's not always effective. So we've identified a number of activities. And what it will do is it will have us go out and create more partnerships with those organizations that serve those folks, not as to homelessness, but as to other needs. And we'll really just strengthen the system overall. And then we want to expand data gathering from public systems to ensure that those at risk of homelessness are prioritized for housing interventions upon exit. This is really where we want to work on reentry, discharge from hospital, discharge from API. If we know someone is going to be leaving that institution to a position of the streets or shelter, as soon as we know that, let's get to work. Let's not wait till 24 hours before, 3 days before. If we know it 90 days before, let's get to work. And so for us, integrating the homelessness prevention response system into those institutional settings where folks know to call us and get that coordinated entry assessment done, we can all get moving in the right direction. Next slide. So that is data and coordination. Again, all of the specific activities are in the anchored home plan itself. I'm happy to take any questions on that bucket.
Great, thank you. Any questions on data and coordination? Yeah, go ahead, Member Constant.
I just received that communication in my email from a constituent, and they asked, can you help define homeless as it relates to the HUD definition?
Jessica.
So that HUD actually has 4 different definitions of homelessness, but when we're talking about anchored home and we're talking about the HUD funded programs in the city, we're talking about definition 1 and 3, which is literal homelessness, which I'll just deep dive into it, which is someone who is in an emergency shelter facility, in a transitional housing facility, or they are literally homeless. So they are sleeping on the streets, or they are sleeping in a place that is not meant for human habitation, which would be sleeping in a laundry room, sleeping in a shed, something that is not meant for humans to habitate in. And then homeless definition 3 is survivors of domestic violence or sexual assault, or fleeing a domestic violence situation. So when we talk about the HUD definition of literal homelessness, that's what we're talking about.
I would note that when we were in DC talking with HUD leadership, they expressed that they are adding overcrowding, or considering adding overcrowding into that definition, because in much of Alaska, even parts of Anchorage, overcrowding is the kind of what it looks like. So the definition from HUD is changing. And okay, thank you.
That's HUD definition 4. I would just add overcrowding is included in a definition, but it is very specific funding sources that allow you to address that particular definition of homelessness. And we are definitely advocating to expand that.
Thank you. Member Brawley?
Yeah, thanks. First, I think that the definition or definitions of homelessness and kind of the siloing of various HUD programs over the years is an issue. And so I hope that, I know we can't change that ourselves, but I appreciate the advocacy to kind of integrate those better and be more flexible. I'm looking at action 4, so it's on page 16. And I think that's more maybe to the question that I'd asked earlier. And I appreciate that this is in here, because I know that it's a huge gap, and it's been a gap for years for folks who exit from prison to homelessness, who exit from the ER to homelessness. And so I appreciate that this is a focus, because again, this has been a known problem for probably at least a decade and before that. My question is, because I'm just looking at these actions, I guess, what progress have you guys made on that so far, or where do you see this happening? And maybe, for example, with the ER or with Department of Corrections. Thanks.
Yep. So on the healthcare side, we're actually pretty far along. We've had a healthcare integration pilot through Providence Hospital for, predates my time at the coalition. We've operationalized that work now, and we actually just received a grant from Community Solutions to really go in and get robust coordinated entry hooked into those healthcare institutional settings. And so we're really hoping to have that fully integrated into 3 out of our 4 hospitals. And by hospitals, we mean API, regional, Alaska Native Medical Center, and Providence. So we're shooting for 3 out of 4 in the time of this plan. With regard to reentry, we are a part of the Reentry Coalition, so we've laid some groundwork there. So we think we have a good base to start jumping into these deeper conversations and really explaining how we're there to help them find more successful exits when people are reentering into the community. It is much easier for a reentrant to remain compliant with their terms and conditions when they have a place to be. One of the big challenges for street outreach has been, how do we help folks charge ankle monitors if they have nowhere to be? There's no source of electricity. We literally take around giant battery packs so we can have people plug in, right? Wouldn't it be just better to skip that step, have a reentrant going someplace, right, where they, hopefully a home, but if not there, somewhere where they can go and remain compliant.
Thank you. Yeah, Member Branga.
Thanks. I'm worried about the overcrowding part. I work at ANTHC one day a week, and culturally, there are lots of families that like that setting. I was interviewing someone yesterday that they're in a 1-bedroom place in the village with 10 family members, and I wouldn't want to say that that's something that's warrants housing. They kind of like their tight family structure. She didn't feel anything wrong with that. So I feel I'm a little nervous about the crowding issue when I also think of some of our mobile home parks that are they're really large families in them. And I mean, this could really quickly overwhelm us if
Fair. So I appreciate that concern. What we know, though, when we're talking about overcrowding, isn't multi-generational households by choice. What we were talking about is overcrowding where folks are sleeping in shifts, where there just isn't enough space to actually exist in the home and live there. We know out in rural Alaska that there are families that actually rotate who is actually staying in the village versus going to a hub community for something else because there's just not enough physical space. And when we start talking about overcrowding, we use a very data-driven approach. There is statewide data about overcrowding, and you can see where different areas are overcrowded, severely overcrowded, and then in Anchorage, we still see through the national standards that Anchorage is overcrowded. So we're not talking about breaking up or changing family choice or units. What we are talking about is where there is the desire for where there's the desire to be able to live, there is more housing developed.
Thanks.
Thank you. Member Constant?
Yeah, I just would add, in working with Senator Sullivan to tackle this HUD funding formula issue, he convened a working group between urban and rural Alaska, housing providers and policymakers. And the rural Alaskan contingent of all of the village housing cooperatives made it explicitly clear that it is a crisis in rural Alaska, the overcrowding issue. It's not really a debate that families want to have 3 or 6 families living in one 3-bedroom house with 15 people. And like Ms. Zalatel said, shift sleeping, and flipping, depending on if it's the school year who gets to sleep at night versus in the day. And then when those bed spaces are exceeded, that's the math that I think is broadly recognized across the state as a crisis out there. And it's challenging because that is an element in the breakdown of the system that puts Anchorage as that community that is the number one receiving area for people who aren't able to be housed in their communities. It's mostly a housing issue, not any other issue that a lot of people over time have contemplated why it might be happening. And the reality is a housing unit out there that you can build in Anchorage for $300,000 to $400,000 is $900,000 to $1 million because of the relative costs. And so we share a crisis with rural Alaska, and we will share a solution if we're going to tackle it.
Thanks. So I have myself in the queue, and then Member Brawley. So a couple of things. One, on that point, not to belabor it, but through my work with AML, the Alaska Municipal League, I think I've heard a lot of the same things that Member Constant has from rural local elected officials, that this is a crisis in their community. So, I think I don't want to disregard that there may be multiple perspectives or multiple modalities that people enjoy, but certainly just based off of everything that I hear from the ground, it is a huge issue, and it's why rural local elected officials have really supported a lot of the housing and homelessness efforts through AML, to whether that's funding the housing trust, the statewide housing trust, or other efforts. Next, this question is for the coalition. So I'm wondering if you could help me connect a little bit of the metrics here and the specific actions. So I get the actions of, we need more coordination of coordinated entry, and we need more people putting into coordinated entry, and all of these different systems working better together. But can you help connect how all of that will lead to these metrics? I assume the goal is for these metrics to go down.
Yeah. So until someone is in coordinated entry or in HMIS, we don't know who they are or where they are, right? So one, we want an accurate count. I would say our data is pretty solid right now. There's been a lot of years and a lot of time spent on getting us a really solid baseline. Coordinated entry, you have to have a coordinated entry assessment to be active for a housing referral in the system. So the more places we can have coordinated entry and updates to coordinated entry, the more likely you are to be prioritized. Well, you are going to be prioritized for a housing referral. You're also on everyone's radar. We have an open data system, so we are able to then collectively problem solve based on that coordinated entry assessment. And that's why that assessment is so important, that it's person-centered and really tailored to get into a person's housing assets and then their housing complications, whether that's a pet or something. So that we're all on the same page about what we're trying to achieve for that person. Additionally, this really shifts the system into a person-centered approach versus a programmatic-centered approach. And we believe that that will increase the people exiting to permanent housing destinations and reduce the returns to homelessness. And similarly, the reason we've got the percentage of people exiting into HUD or other size programs is until there are more of them, we won't see that number go up. And so it really drives us to work with AHFC on vouchers or more opportunities to pay rents, which again, we think will help reduce the returns of homelessness. So it's all about keeping everyone kind of front and center in a way that we can handle, because it's a lot of individuals all working to reduce that length of homelessness. So that's how we believe all this coordination will come down, right? In the end, like I said at the beginning, if we aren't affecting people's lives in real ways by reducing their homelessness and the length of time homeless, all this coordination doesn't matter.
Great. Yeah, no, I appreciate the phrasing that you used about this coordination is about the people, and making sure that we're keeping that picture of the people front and center as we do the work. Member Brawley, and then I think we need to move on.
Okay, yeah, briefly, just 2 comments on overcrowding. I just want to underscore that is something that was shared at the Alaska Municipal League meeting last week. And I think I've said this already, but just in the Yukon-Kuskokwim Delta region, Western Alaska, one of our most growing regions in population, most of their housing need is actually existing residents. And so I just want to underscore that again, because I know we hear from some members of the public, why don't people move back to wherever they're from, or variations on that comment. And then setting aside the conversation of where they're from to begin with, it's just true that if there's not physical space in a community where you can live, or going back to that community means that you're living in a house with 15 other people, for example, then is that really a viable option for folks? And so I think that's an important conversation. And again, the interplay between rural housing issues and urban housing issues is very complex, but it's very real. The other thing is, just to say on connection to housing overall, to the extent that we do have mixed generation families, we have other living arrangements, siblings who want to live together, someone wants to live with their mother, or things like that. A lot of our housing stock simply does not allow that. Not only does it not allow the physical space, but more than half of our housing stock is single family homes, which is contemplated to mean a nuclear family, meaning parents and children and not other generations. And so just to say, you know, connecting to other things, part of our housing solutions are really looking at our housing stock and allowing for just the reality that people have different ways of living in different size households. And so again, that is a much bigger conversation than just this particular population, but I want to underscore how much all these things are connected, and that we have to, again, make physical space for people to live in our community safely. Thank you.
Thanks. All right.
All right, our next bucket, promote equity. So promote equity and seek ways to expand partnerships and to include people with lived experience, ensuring meaningful participation and compensation for their time and expertise. You know, I think there's the old saying, nothing about us without us. Lived experience can be current lived experience and it can be past lived experience. And where this really comes in on a systems level is as we hear each person's housing journey, what's worked, what's not, we can improve what we do. But we don't learn that until we have them at the table. So what you'll see on the next slide are a number of actions to really strengthen that participation. So the first one is strengthen and expand meaningful opportunities for professional development and mentoring focused on supporting people with lived experience. So what we want to do is we want to increase the number of people with lived experience. It's actually lived experience and expertise. Now HUD has updated the term, but really want to increase that participation both at the coalition itself and at the advisory council. If we are talking about systems policies and how the system works, we need those voices at the table. Similarly, we want to ensure that we are out there asking for lived experience. So we are being upfront about it, and that we want to maximize the scoring on our annual notice of funding opportunity. HUD has really underscored its voice being present. We want to provide meaningful ways for lived experience in a way that those individuals feel supported. Right. And so it's not just simply, hey, we want you to have a seat at the table, but do you want or need any specific training or mentoring opportunities? Not only do you have a seat at the table, how can we make sure you meaningfully participate and are comfortable with how that table is set? Or do we need to change how the table is set? Right. It's really hard to say, well, we're only meeting via Zoom, but you don't have access to the technology. We want to get out of our own way. And then create opportunities to allow funds to compensate people with lived experience participating on boards and councils. Right now, there's only one fund source that really has that designated purpose, and that's our COC planning grant. HUD has said you can use some of your money that plans for the system to compensate individuals with lived experience. So we really want to explore, can local or state funders or philanthropic funders really help underscore this importance by putting money toward it so that we can adequately compensate people for their experience. So that is those three actions there. As you will see, the activities are actually quite a bit more specific. And then we have one more action, and I guess maybe there's one more slide. I didn't make it. Nope. Okay, one more action didn't make the slide. Support meaningful opportunities to promote cultural well-being and intergenerational healing for those with lived experience who are Alaska Native. The disproportionality of Alaska Native people experiencing homelessness is shameful for Alaska. It is about 46% representation when the census data is 7%. We need to affirmatively make the commitment and take responsibility. And so we not only want people with lived experience, but we want those who are most represented in the system, because what we have to ultimately do is break down the systems that led to that overrepresentation. So I'm sorry that one didn't make the slide, but that one is really important to us, and we need deeper partnerships with Alaska Native-led organizations so that we make sure we're going about this in the right way.
Great, thank you. All right, so questions folks have on this bucket. We'll start with Member Brawley.
Yeah, this is on that action you just mentioned, action for the cultural opportunities. I really, really appreciate this. I think that is a direction that the tribal health system has been going for a while and other tribal organizations. So I guess I just wonder, have you, if you can just describe kind of what work has already, or what discussions have already been happening on that one?
There haven't been any, and that's the problem. So I think that's, well, one, it's there. We at the coalition have made sure we have some Alaska Native voices and great leadership. And frankly, when we first published this, I will take full responsibility. It wasn't there, and our board member Emily Edenshaw flagged it, and she was like, "Whoa." And that's right. That's what we need to do. We need to be called out and told, you need to do this. So we're at the beginning of our journey. We welcome all of your participation. And of course, we think it's a collective community conversation that really needs to be had.
Great, thanks. So I have myself next in the queue. Just a question on the baseline data here for Action 4. Does that include individuals who identify as more than one race, multiracial?
Yes, if they reported that one of those races was Alaska Native American Indian or, yeah.
Thanks. So does, I guess part of the reason why I did a little bit of a because I think some of you know I'm quite fond of the census. So I'm not sure that the 7% that you reported also includes that multiracial. I think it's just Alaska Native, that 7%.
Yes,
Yeah.
that is true.
Okay.
Currently, the census data collected does not allow people who are reporting more than one race or ethnicity to report what those multiples are. So that is, you are correct.
Okay, great, thanks. Okay, did I have anything else? Nope, I'm good. Any other questions? All right.
All right, we are nearing the end, folks. Last bucket, increase funding and coordination. So we want to increase access to housing and homelessness funding to coordinate and leverage funding opportunities with existing state, federal, local, and philanthropic funding. So I want to share with you a brief story before we dive into the specifics. We have our great partners in Houston, and I don't know if you've read the paper lately, but the city of Houston is having a bit of a funding crisis, and they are having to have really hard conversations about their parks and trails and their city services. You know what's not on the table? Their homelessness response system. And that is because it is robustly funded through federal funds and a voucher program. So this is right, this focus on funding provides resiliency to the system. So with that, we'll dive in here. Again, we want the metrics to come back to being people-based. So number of people experiencing homelessness, length of time homelessness, first time homeless, and percentage of people exiting to permanent housing destinations are how we'll measure our success. Next slide, please. So we want to braid and leverage assets to create funding plans to support housing opportunities and support services. Braid and leverage. Right now, we really want this approach to be, okay, we know this person has these needs. No program can adequately meet them. How do we braid, leverage, and coordinate to meet that person's needs, right? Person-centered opportunities. And right now, we don't have formal agreements aligning funding. There is a funders collaborative technical assistance group that's been meeting. HUD has been convening us. We did manage to test pilot a few things out of that, but really the idea is, can we make any alignments on our timing of funding, our funding requirements, and then can there be cross-population of those scoring committees? So we're kind of in the know about what the applications are coming across the system. Action 2 is investigate new funding sources to increase resources for housing and support system. While we keep talking about HUD, there is other housing for money out there, whether it's through the USDA, the Department of Transportation. There are just lots of things we could be seeking. So we really need to develop and strengthen that capacity to look for all available funding to address this problem. And then engage all sectors for possible donations of resources, land, or property for affordable housing. Right. This ties back to the creation of the housing units as well, but we want to really make sure we're expanding the conversation about how we're going to solve homelessness beyond just homelessness service providers. We need to have a broader conversation, and even just beyond low income housing providers. We really need to involve everyone. We recently had the opportunity to support a low income housing tax credit application for 2 and 3 bedroom apartments by a $1 million home builder. Right. So a home builder said, you know what, I have this expertise. I've never done a low income housing tax credit project, but I want to give back. And we're like, wait, we are here to support you in anything you want to know. And we really think it's that kind of vision and lens and bringing together and deepening those relationships that is really important to making this successful. And that is the end of that slide and in that bucket.
Great. Member Constant?
Thanks. So I'm looking at the printed plan versus the slide deck, and the printed plan is missing a third bullet, the third one there.
No, actually, that shouldn't have only just been in the first one, but it all intersects. It should have only been in the housing development one, but it all works.
I see. Oh, yeah, because my comment was going to be, I would suggest adding a phrase to that action 3, and that would be possible donations of resources, land, property for affordable housing and supportive services. But if you're speaking in specific to the housing bucket, then it makes more sense. But I think that if there are no creative partnerships and that's an opportunity for development, probably there are some partnerships that could be developed on the front of the service side as well, whether it be food, whether it be clothing, whether it be other areas that are not necessarily clinical that would have to be clinically provided. But anyhow, just some thoughts about that. But if it belongs somewhere else, then that's great.
So it does talk about supportive services, but it's not.
It didn't really matter.
Great. Thank you. I had myself in the queue to basically mention the same thing, but that's already been addressed. Any other discussion on this bucket? Okay, great. Then if you want to go ahead and make any other remarks that you may have, and then if there's any final discussion that we have on the plan as a whole, we can do that.
Sure. I believe on page 12, Mr. Constant, some of the things you're looking for are in the activities that support that action item. So we want to use this as an invitation, right? Anchored Home is an invitation to engage. And we know the Assembly has been engaged. We hope that this provides a roadmap and a blueprint for strategic engagement. And I believe over the last, the 2 and bit years I've been in this role, it has been strategic and coordinated engagement. This really just brings a lot of that down into writing. We would welcome and ask for your adoption of Anchored Home. Our COC has approved it. It is required for the continuum of care to have a strategic plan. This is now their adopted strategic plan. And that is why, we have set the coalition as the responsible entity for this. But we know this plan doesn't work unless the community works the plan together. So the last thing I want to say is if you happen to see my socks, I have Anchored Home socks. So that's really exciting. I'm very excited about the socks. I love to coordinate an outfit to a topic. So.
Great. Thank you. Member Brawley.
Just a comment and then a brief question. I really appreciate the focus in this plan. So as somebody who was very involved in the creation of the original Anchored Home, which was started as really a community plan and then was adopted by the municipality and I guess technically is still our plan at the moment. One of the pros and cons of that plan is it was so broad and it had so many things in it. And I think it really going back and looking at that plan, I would encourage the public to do that. We've come a long way. A lot of the focus in that plan was really just mitigation and management of the problem. And it wasn't looking toward, it kind of had the laundry list of solutions, but it wasn't as focused and there wasn't the really targeted metrics. And I think it didn't really have a home, so to speak, the plan itself. And so I really appreciate the coalition stepping up, taking leadership on this. And again, focusing on how we make a meaningful dent in the issue as opposed to kind of the universe of ideas that have been out there the last few years. So I want to say that. And then the quick question is are other members of the public available or able to get the Anchored Home socks?
So originally the Anchored Home socks came from participation in the Emergency Cold Weather Shelter Task Force, because if you participated in that task force, you deserved something. We figured, and it was Anchored Home in action. But yes, we have extras. We would be happy if someone would like some Anchored Home socks to provide them.
Great. So I am next in the queue, and if other members have any other thoughts or questions about the plan as a whole, now would be the time to do that. So with regard to adoption of this plan, I think folks, actually, I think most folks here probably weren't on the assembly when we did adopt I think it was the 2018 plan. I think we adopted it in either 19 or in 2020, one of those years. Thank you. I'm reminded that it was in 2019. The assembly adopted the Anchored Home Plan. And I think since then, we've readopted it a couple of times through various other resolutions. So that is essentially how we would do it. We would have a resolution that would typically be a policy resolution. So it would be in our 10 Bravo section on the agenda, in which we would formally adopt the plan as the municipality's strategic plan, 5-year plan to solve homelessness, as phrased here. So that's probably something, since the coalition has officially requested that, something that we will probably look to do in the future soon. Okay, so any other questions, thoughts that folks have? Okay.
I was going for the mic.
Go ahead, Member Constant.
Yeah, I just want to say, as someone who was here when we first adopted the plan, it was pretty unexpected that we did, just because of all the tensions that had been around the conversation for so long. And I think the pandemic forced a lot of change and questions on us about how we're going to deal with these issues. And I am grateful for the second version, the update, the kind of evolution of this plan, so that as the world has changed, we can continue making sure we have a collaborative agreement on how we're going to get there. The fatal flaw of our efforts over the years, and this goes back probably 20 years, is that we have a built-in policy change potential every 3 or 6 years that comes with an election of an administration to the municipal government. And in my opinion, and I've said this now for a number of years, our best focus is when we find a way to move the locus of this work, the center of this work, out of government that is subject to this intransigence and change so frequently, and into the hands of the community, so that the community can ensure that the work that is proposed and is being done is the work that we need to do to address this enduring challenge that so many plans have been written to try to tackle. And so I'm really grateful to the coalition for ensuring their role in this place in the community, and for the community providers who have recognized that this is in fact how it is. And I look forward to the question being before us, whether we adopt this plan.
Great. Any other thoughts? All right. Well, I'll go ahead and provide some closing thoughts before we move on. So I think, as Member Constant and others have said, this will be before us for adoption. And so if we have any other thoughts or concerns or questions, there will be the opportunity to debate this formally when we have it before the Assembly on an agenda. I will just say, comparing, I won't use the 1.0, 2.0 monikers, but comparing the 2018 version to this evolved version of Anchored Home, I really do appreciate how there is such an emphasis on coordination and not siloing. I think that was one of the things of the 2018 version, that the way that it was quite literally, charted physically, the silos were quite there. And I think that made it sort of difficult in the future for us to think outside of silos. But now with this evolved version, we don't see silos anymore, which I appreciate. And there's so much of a focus on coordination, which is really critical. We heard time and time again when Houston was up here that coordination was everything for them. That's how they were able to be so successful and able to get more federal dollars. Also, what I like about this plan is that it's really focused on goals, actions, and metrics. So it's very much, it's an action-driven plan, which, we have focused on various plans here on the assembly over the last couple of years, and so I really appreciate these last upteenth pages of the document where it really dives into the specific. And I look forward to the eventual metrics dashboard being created so that we can really keep track of it. And I think one of the things the coalition said, I think it's important to repeat and highlight, that this, and particularly the responsibility for this plan, lives within the coalition. It doesn't mean that we're not going to play a part, right? We are obviously going to play a part when it comes to funding, as we've had in the past. I imagine those will be discussions that we have going into the future. And then there's also a variety of policy decisions that we make. In fact, tomorrow we have a whole meeting scheduled to talk about policy decisions regarding homelessness. So it doesn't mean that our role is going to be diminished somehow in this work. But I think really what I have heard today is that this is a plan that is our community's plan, and that the coalition gladly accepts responsibility for making sure that we as a community succeed. But obviously the coalition can't do it alone, which is why there's such a focus on partnerships. So looking forward to that continued partnership and getting this done. With that, let's see, anyone else? Anything final? You're done? You're done. Okay, great. Then we'll go ahead and move on in our agenda. I really appreciate the presentation. Okay, so then we're going to go ahead and roll back to unfinished business. And we will go to the health department. It looks like we also have Parks and Rec here to see if there's any general updates on either the emergency cold weather shelter plan or the transition out of emergency cold weather shelter. So any new information that the administration wants to share with us on those two topics?
Good afternoon, everyone. Alexis Johnson, Anchorage Health Department. Just to give a brief update on shelter. Currently, let me get my numbers. Sorry for that. Currently, last night we had 190 clients at cold weather shelter off 56th Avenue. The Alex and the Aviator are on a decompression schedule right now. The Alex has 72 people currently in shelter, and that number will go down to 52 people on May 1st. So we are actively decompressing through attrition only. The Aviator is at 264 last night. This is a little bit of a higher number than they had for their decompression schedule. As of April 15th, they should not be exceeding 218 people. And we have let the Aviator know that they have a budget that they are not to exceed. So how they work that schedule, we're currently monitoring, but they are a little bit behind schedule. Right now, we are no longer transporting between CWS and the Alex and Aviator because they are on an active schedule, decompression schedule. And I think that's all my updates for right now. I did want to communicate that we did have a Davis abatement for the parking lot. I believe there was 20 individuals staying in that parking lot, and that abatement is still underway. So,
Great, thank you. Member Brawley?
Yeah, I have a couple questions, and I apologize. I need to leave in a couple minutes, so I'll be brief. So it sounds like because it's still 2 per room in the hotels. Is that correct?
correct.
Okay, so then we're looking at 26 rooms at the Alex as of May 1st, and then it sounds like 109 rooms at the Aviator. Is that accurate?
I don't know the room schedule at the Aviator. I just know that they have a per person max not to exceed. And so from April 15th to April 30th, they have a not to exceed 218 people. And right now they're at 264.
Okay, thank you. And then my 2 questions are, you mentioned transportation. Do you have an update on whether there is still funding available for clients? There was $200,000 that was put from alcohol tax starting January 1st. And then my other question is if you could list off the specific sites that currently have an abatement notice or are being actively abated. Thanks.
Through the chair to Ms. Brawley, we have transportation dollars available. That money has been slowly being utilized, but not to the effect of $200,000.
Great, thanks. So I have a quick question, and then I have member Constant in the queue. So, and maybe you mentioned this and I missed it. Have there been dates set where there will no longer be any clients admitted to the locations?
Through the chair. So the Aviator and the Alex are no longer taking clients. We're on an attrition schedule. As far as CWS, my fingers are still crossed that we're going to get funding and continue services there. That's something I did want to bring up. We will need to identify some bridge funding, I think, to get us at least through the month of June, because I don't believe the state will start funding, if they do fund us, until July 1st. And I'm not sure if we can backdate that funding, some creative, nope, can't. So got to find some bridge funding for June.
Great, thanks for that update. Member Constant?
Yeah, thanks. Received an email question being, do we have a plan to place the individuals who have the highest challenges, the hardest to place, out of shelters? Last year, we had the Golden Lion, which stood up and took a number of really hard to place individuals. So have we put any thought to what happens to the folks who are the biggest challenges? Because that I probably would go a long way to providing community protection, is ensuring that those people have some plan.
Through the chair to Mr. Constant. So we have been working with Henning to identify people who are in that high needs assessment in the Aviator and Alex. Right now, the Alex really doesn't have high needs. That's why there's been a lot of success in the housing opportunities that we've had through Next Step. But we are working with Henning. I will tell you, a majority of the people who have the highest needs are currently in CWS.
So then the logical thought there would be, the plan would be, as funded, keep them, because until we find a place that works for their needs, then we have a place and don't have to displace them.
Correct.
Thank you.
Yes, Member Johnson?
Yeah, thanks. And I think you just sort of partially answered this in your question to Chris. And I also know that this is not as simple as maybe it sounds, but as people are transitioning out of the Alex and the Aviator, are you guys making an effort to track where they're going? Do we have any sense of sort of, generally speaking, where people are moving on to?
Through the chair. So Alex remains a Next Step initiative focus. So a lot of the people there we're trying to identify housing to get them out of the Alex and into housing. We do track exits, whether that's exits to API or to housing or to the streets, but it's kind of a broken data set because some people just walk away from the shelter and you don't know where they're going. I will tell you right now, we've had a large focus of people who said that they don't want to go back to the streets, and they've really felt a sense of security and stabilization in these shelters. And so we're actively trying to ensure that those people have a plan when they do leave May 31st.
Okay, thanks. So, and yeah, I get it stuff, but we don't have you don't have information like, oh, we think, 40% are moving in with, family members, 20% to subsidized housing, 30%. We don't know anything like that.
So RRS, our third-party oversight contract, works with a lot of the clients through Henning's housing to ask them, like, what is your plan come May 31st? I'd be happy to work with Henning and RRS to figure out if they have a data set for how many people have a solid plan. That's usually something that we don't often hear from clients, is what their plan is, because usually when the doors close on, April or May, they just go back to the streets.
Yeah, thanks. I feel like that might be interesting and informative. I mean, if we find out that, 80% of them, right, end up back on the streets, then that's certainly good and a poignant number to know. And if there is, if we find alternatives for some of these people, maybe that points to solutions that we should try and expand upon. So anyways, I'd be curious to know more about it.
Thank you. Member Bronga?
I just wanted to follow up on Anna's question of where abatement was happening. I know Davis Park, but there's also Cuddy, so just love to hear that.
Yeah, thank you for the question. I didn't take the baton when it was passed to me in the second half of that question. So Davis Park parking lot, not the entire park and not the snow dump across the street, but just the parking lot. It was posted on April 2nd with a 10-day zone abatement based on shelter space that we had available. And APD and Parks and Rec began to work on that 10 days later on the 12th. That was Friday last week. The CAP team has a 3-day they work 410s, they have a 3-day weekend. So we resumed those activities yesterday, and it'll probably take the remainder of this week to finish the cleaning at Davis Park. One of the challenges too is at some point with a zone abatement, you have to call the abatement complete and move on. And I think the challenge with vehicles is the vehicles come back more readily. People need to park them somewhere and they're used to it. And I think this is just part of the challenge. So they tend to gravitate back. The second part of the question, the archive sites, Cuddy Park and Lusac Library as one collective zone were posted for abatement on the 10th of April. And the abatement date that will be acted upon is the 30th. And so that's a 20-day notice, which is twice the legal requirement that was provided for those campers. And of course, with that, we understand that it's breakup. That site is melting. I think giving people more notice is an appropriate approach, and working with people as exiting the site becomes less challenging is something we'll be doing. So
I was just thinking that if we do move forward with safe parking, it would be much kinder to have that established. So when you abated, that you could say these sites are available for parking. Right now, there's really nowhere for them to go. Like you said, they're going to be just coming back or parking in another place that they end up getting into trouble. So
sure, I think that's correct. And I think that's one of the challenges we get asked, where can I go? And yeah, it's part of the challenge.
Great, thanks. Before I move on in the queue, I just want to get a quick show of hands, folks in the audience. And just so you know, if you're behind the pillar, I can't really see you. Show of hands of folks who want to participate in final audience participation. I have 1, 2, 3. Okay, I have 3 individuals. Great. So then I will need, rather than, can I get a motion to extend the meeting by 10 minutes?
So moved.
Okay, thank you. Is there any opposition? Seeing none, we are extended by 10 minutes. All right, Member Constant?
Yeah, thanks. On the Davis Park cleanup abatement, do you know if they've had a chance to clean up the street abutting the park? Because I know with the complaints that I'd been receiving for a while, it was both the park site and the road adjacent.
Is this the east-west road, Mountain View
Yeah, I
Drive,
think
or
it's
is this
the
like Pine Street, the
north-south,
north-south?
yeah, Pine.
Yeah, so we didn't draw Mountain View Lions Park into the zone abatement. It's not public property. It's a private park. And that's a challenge as well. So
I guess, okay, so that's further down. Okay, so, but the street right away is still public, right?
the Pine Street is, yeah.
And so have we had any opportunity to send in the Healthy Spaces team on our right of way?
Happy to take a look at that. Our focus has been on the
Abatements.
parking lot so far.
Okay,
So,
thank you. I've
yeah, but happy
definitely
to.
been hearing a lot of noise.
Getting feedback. Okay.
Great. And then I had myself in the queue, but I don't remember what for. So that's okay. All right, we're going to go ahead and move on to final audience participation. If we can get the clock set up, and then if we can get a mic set up. All right. There's 3 individuals, just first come, first serve. Whoever wants to go first. And if you can state your name for the record before you begin, welcome.
Yes, Ronald Leva, 50-year resident adjacent to the Brother Francis Shelter. And I'm here today. First of all, the notice didn't come out for this meeting until today. So to make a public appearance request, the notice was late. Mr. Haberman wouldn't put up with that. Of course, he's dead. My question today is, we had a little presentation by Henning about the tent. Unfortunately, in my third request to let me present the tent proposal, because I did have a plan. I did have a budget. I did communicate with operators, and I do have the numbers for a rate of return that this facility collecting dust and storage should be immediately brought to Anchorage and get a plan, and I'll work with Henning because I think a joint effort, more voices, more partnership from the public, the better results. So hopefully if we don't merge, I again repeat my request to do a presentation. The second thing I want to talk about is, since you're out at Solid Waste Services, the cold weather, again, it is a regulated utility. You're using that facility. Someone complained to the RCA, you're going to have some trouble with some garbage pickup rates because you're getting a steal of a deal, and Solid Waste Services is not in the homeless services industry. So that's going to be challenged. Second thing, since you're out there, I did a presentation on repurposing metal structures, which is dumpsters, and I call them upstairs. At the University of Texas, they had a professor living in one for a year. So this year, when no matter what the exit plan is, don't allow any tents because they don't really sustain a good weather pattern, all kinds of biological hazards, etc. You steam clean a dumpster, they lay them on their side, it'll fill as a individual unit. And then the third thing, real quickly, you recognize STAR. In 3 days, I witnessed 4 days, I recognized 3 sexual assaults. I was called to the grand jury to testify. Believe it or not, that was 6 years ago. They're going to call me again. So there is no real justice for people who are abused. And the woman who broke into my house for the second time, she was arraigned on Monday, but postponed the hearing. And each time
Thank you,
a victim
Mr. Oliva.
has to testify, I'll summarize.
Your time is up,
Felix,
Mr. Oliva.
that it just opens up another wound. So there's more victims than just.
Thank you, Mr. Oliva. We have a
who was
couple
raped.
other folks. in
Okay,
line
do you
to
have any
testify.
questions?
I do not see any questions for you. Mr.
Okay,
Oliva.
make sure you put out the public notice in a timely fashion.
Thank you. There were 2 other individuals. Whoever would like to come up first. Yeah, if you want to take a seat there, welcome. And then if you want to click the button, make sure it's green, and then you can begin.
Okay, first and foremost, I'm completely blind, so I'm not going to be able to make a lot of eye contact,
Okay,
so I'll do my best.
thank you.
Yeah, I don't have
Great.
Yes, ma'am, thank you. Okay, I'm prepped, so. Can everyone hear me?
Not super well. If you could take a
Alright.
seat, there you go. That'll be better.
All right. Now, society is judged by how it treats the weakest amongst. I have observed the problem of housing for each assembly for 5 years now. The speeches, the debates, the proposals, the money. I'm here to ask the people of Alaska, you need to demand it is not to exist here, not in this state. You must participate, perhaps lead, or you succumb, as other states have. Come together on this topic, donate, but watch closely. Evoke accountability for the funds. Demand results. Don't hope for the best. Be not involved and indirectly blame. Stand up. This will go on no further, not another year. They did it in other countries, so why not here? Because here, the divisiveness still allows those in power to go home each night to a home, a meal, and a bed. Be denied those one day and see what loss does to you and your life And what would you do if circumstances dictated you ineligible for help? Will all your choices be good ones? A person is judged on how well they ride out the storms that come, but not all have been trained, and not all have fallback. If you contemplate what I've just said, apply it to the life you think cannot be touched or changed, and go to work with passion and determination, if you will all work together and solve the housing problem, you'll reap the benefits thereafter. Be the ones to solve the ongoing problem. What a legacy to be remembered for. And think how you'll feel when your children and your constituents and your state look back on how you put aside the vast divide amongst you. You have to put the human costs above all else. You depend on the people that keep this state going, also your working class. They will endure, but why must they? I suggest a second look at all the poor in this state. And remember, cash is not class. It is simply socioeconomic status. A structure that can and will become unstabilized if you continue to ignore or not bring to fruition, if you do not work hard enough to attend the needs of those that sustain your positions as they are now. I'm going to very quickly. Am I done?
Yes, your
Okay.
time is up.
Okay.
Thank you.
I can save it. All right. I did forget to introduce myself. I jumped right into it, and I'm sorry. I'm Miss Sophia O'Neill of Eagle River. Thank you.
Thank you. And for the record, that was Sophia O'Neill of Eagle River. Welcome. If you want to come on up. I think the mic is still on for you. Oh, did she leave? Oh, there she is.
I had to stand aside so she could walk out the door.
Hello, my name is Alicia Gonzalez. I'm just a resident of Anchorage, Alaska. I have been on the verge of homelessness for about 3 years, I would say. I am a pediatric cancer survivor. I had Ewing sarcoma in my skull between my brain, and it have some cognitive issues because of it, some deep trauma that's hard to get rid of. But what my point is there are two people that have kept me from homelessness. Two people, my mother, who is in her 70s, and my girlfriend. And, if my mom passes and my girlfriend decides it's too much, I don't know what. You say homelessness, but you act like it's houselessness. You say you want to give these people 4 walls and a roof, and I get that, but that's not home. You call them homeless, right? I guess I just want to invoke your perspective and your hearts to know that I live in lower middle class, make so much money that I can't be on Medicaid, but I can't afford my medication. And so it's just, I can't hold down a job because I get emotional, and it's not professional. And so there's more to it than affordable housing. And I just implore you to please just help these people, because I'm here because I saw the Cuddy Park, and they want to make it apartments, and I saw that the Sullivan Arena is going back to an entertainment place, and I used to work there as a security guard, and I just want you to feel for these people, because you don't know what it's like. I'm sure some of you do. You have perspective. You can equate it to the hardest part in your life, but it's when you've lost your parents, and that ache that you feel, that loneliness that you feel, that's what we feel all the time for no reason. I have food, I have shelter, I have 2 people that support me, but I would be drunk on the side of the road if I didn't have just those 2 people. And I have a bigger family than that, but it's so complicated. And I just implore you to please just don't, I don't know, just don't vote no. Just help these people, please. Just have a heart for them, and realize that it's harder than you think. It's not just a go get a job, and just McDonald's is always hiring. It's not that simple, and I just implore you to open your hearts to things that you've never experienced and never felt, because life is a lot harder than than ever. And I know that you feel that when you go to the grocery store and you spend $20 and you have 4 things. And it's not just affordable housing. They get affordable housing and it's afford groceries, afford car insurance. Just please help these people. Thank you.
Thank you. Mr. Constant?
Yeah, one of the commenters suggested that the solid waste service utility is RCA regulated. It is not financially regulated. So that's not a matter we have to concern ourselves with. It is regulated by the EPA and DEC and many other entities, but financially, the decisions are the utilities and the assemblies.
Thanks. All right, with that, we are adjourned. Thanks, everyone.